Thank you for coming to our poster presentation titled Acceptability of Sulfamethoxazole Torinmetoprim in Pediatric Inpatient in Japan. This study was conducted as a collaborative study with National Center for Child Health and Development, that is a pediatric hospital in Japan, and ClinSearch in France. The efficacy of the treatment of infectious disease is likely to be negatively affected by poor medicine acceptability, resulting in adherence issue. Better taste and gritty texture of ST mixture granules seems to result in acceptability issues. In Japan, ST mixture is commonly used for prevention of pneumocystis pneumonia following liver or hematopoietic stem cell transplantations. In EU and US, ST mixture is a treatment option for the daily prophylaxis of the urinary tract infection, the leading nosocomial complication following pediatric urological surgery, and it might be an interesting option in Japan. Previously, we demonstrated the acceptability of cefaclor fine granules for urinary tract infection prophylaxis in pediatric patients. Herein, we use the same validated data-driven approach, the ClinSearch Acceptability Score Test, to investigate the acceptability of ST mixture and compare the acceptability of these two drugs. This study was conducted as a single-center cross-sectional and observational study. Patients less than 18 years treated with ST mixture with an oral consent obtained from parents were included. Using a standardized web questionnaire, trained researchers observed results of intake, patient reaction, preparation administration time, and any methods used to help with taking the medicine, such as using food, drink, reward, and so on. For the data analysis, we used the Acceptability Reference Framework, a three-dimensional map juxtaposing two distinct acceptability profiles, positively accepted or negatively accepted, materialized by the green and red areas. Multivariate analysis mined a large set of standardized evaluations of the intake of many medicines in patients from 9 countries, comprising those collected in this study. 68 evaluations of ST mixture granule were collected. The mean age of the patient was 3.6 years, the range of age was 0 to 17 years old, and 60% were girls. According to the reference framework, ST mixture granule was not classified as accepted as 14% of ellipses surrounding the barycenter were in the negative area, materialized in red on the map, as shown in the figure 1. Comparison analysis between ST mixture and cefaclor. ST mixture was significantly less accepted than cefaclor, as shown in figure 2. This reflected significant differences for 5 of the 9 observed variables, such as a patient reaction, preparation and administration time, using food or drink to mask the bad taste, and so on. Regard to the influence of patient sex, there was no difference between boys and girls. We also tried to analyze the influence of age on acceptability. Because 37 patients are aged 0 to 2 years old, as 39% of ellipses were in the red area, but there were too few participants for other age group to compare. Conclusion: the findings from this study highlight acceptability difference between cefaclor and ST mixture, reflecting palatability issue of ST mixture, which cannot be considered as positively accepted. The required dose of ST mixture was fully taken for 99% of those 68 evaluations performed at hospital. However, a half of patients had a negative reaction, and they used food or drink to mask the drug's bitter taste. Previous findings indicate that oral liquid preparations of antibiotics were better accepted in hospital than at home. This difference is likely due to a healthcare professional skills. Further study will be required to explore the influence of ST mixture palatability issues on medicine intake at home. Thank you for your kind attention.